Question: how many of you have been diagnosed with kidney disease and you were completely shocked because you weren't aware of the symptoms or the risk factors? Please leave a comment below. Chronic kidney disease. That sounds kind of scary, doesn't it? Well, I don't want you to be scared. I want you to think about chronic kidney disease as part of a spectrum where on one end, you basically got patients that have no idea that they have this condition at all and they have no symptoms at all. And on another end, you got patients with quite severe symptoms and quite severe disease. And basically the job of your doctor or your healthcare professional is to stop you from going from here to here. Now, the way in which a doctor will stop you from progressing to an end-stage kidney failure is by doing some regular monitoring, which will include blood tests and urine tests. And also your risk factors will also be controlled. So these are risk factors that increase your risk of end-stage kidney disease. So there are two main risk factors for the progression to end-stage kidney failure. This is hypertension and diabetes. So your doctor will make sure that your blood pressure is really well controlled, and also they'll make sure that your sugar levels are well controlled, which may include really keeping on top of your diet, and if needed, being on the correct medications to keep your sugar levels within normal range. Hi, it's Dr. Derek here. Now the reason why I made these videos is because I truly believe in creating accessible healthcare content that will allow you to make better decisions about your health. So what are some of the symptoms that you may experience if you have end-stage kidney disease? Well, I'd like to go through 5 of the most common symptoms you may experience. So let's talk about our first symptom of end-stage kidney failure. This is the presence of excess fluid. Now, excess fluid occurs because the kidney usually functions to remove any excess fluid and some electrolytes such as sodium. Now, what happens when the kidney function drops is that the kidney can't really perform this activity efficiently. So the kidneys can't really maintain the body's fluid balance, and then with this you notice that you have excess fluid building up, particularly around your legs, but also other parts of the body such as the lungs. This buildup of fluid can cause weight gain as well as increased blood pressure. This is why patients with end-stage kidney disease are known to have really difficult to control blood pressures. Our second symptom of end-stage kidney failure is the presence of being short of breath. Now this occurs for 2 reasons. So firstly, the kidney is unable to get rid of a lot of the waste and toxins that build up in the body. This can cause an imbalance of all the electrolytes that are being produced, which can accumulate when you're exercising or during any physical activity. This can lead to some shortness of breath. Also, additionally, the fluid buildup that occurs because the kidney can't really function in really balancing the fluid in your body. This fluid buildup can also transfer to the lungs, and as we know, with fluid in the lungs can't really perform the job at transferring oxygen. This is why you might get some shortness of breath with end-stage kidney failure. Our third common symptom is that of anemia. Now, our kidneys also have another role in creating a hormone known as erythropoietin. So when the kidney function drops over time to end-stage kidney failure, the kidney can't really perform its job in creating this hormone known as erythropoietin. Now, erythropoietin is a hormone that creates our red blood cells. But on top of this as well, our red blood cells carry oxygen, and if there's less of them, our patients will also get some shortness of breath, as well as being really fatigued. So basically any activities that you usually do that don't make you feel tired will make you feel a lot more tired than usual. So moving on to our fourth symptom of end-stage kidney failure. This is really intense itching, and it's due to the kidney not really clearing out all of the waste products and toxins that we usually do in our urine. Particularly, there's certain toxins and waste products such as calcium and phosphorus that can really build up in the body and really accumulate in the skin. And this is what causes a lot of the itching that we see in end-stage kidney failure. Our fifth symptom of end-stage kidney failure is that of nausea and vomiting. Now this occurs because the kidney is no longer able to get rid of uremic toxins that are usually eliminated from the body. So these build up, they can irritate the digestive system, and when this occurs, you can get a lot of nausea and vomiting. In addition to this, the buildup of other toxins and electrolytes will all contribute to the feeling of nausea. So I hope you've enjoyed today's video. I think with chronic kidney disease, it's important to know and remember that's all part of a spectrum. So the whole point of it is to stop you from having a progression onto end-stage kidney failure. And this is done by controlling certain risk factors. We've talked about 2. This is diabetes and hypertension. Now, I hope you enjoyed this video. As always, don't forget to leave a like and subscribe. And also make sure you check out some of our other videos that will help you to understand a little bit more about your health. And until the next time, I'll see you soon.